Welcome to our presentation on the Center for Alzheimer's Respite and Caregiver Support, hereinafter referred to as the Center or our Center, by Katie Hoyle, Richard Matos, and Christine Ponick. The Center's mission is to support and care for Iowa's residents and caregivers affected by Alzheimer's by providing quality care, support, and connections. Our three pillars of care are adult daycare for individuals with Alzheimer's, support and respite for caregivers, and connections, which is comprehensive case management. Our adult daycare offers an innovative and holistic approach to memory care with activities tailored to each participant's strengths and needs. We offer both respite and support for caregivers in the form of traditional support groups, activities, and educational opportunities. Connections offers participants and caregivers case management services to close the gaps in care for their loved ones. The center is conveniently located on the Des Moines University campus, and we serve the greater Des Moines metro area. Our primary population is individuals living with mild to moderate Alzheimer's who reside in private residences. 29% of existing dementia daycare centers have a waiting list, and that number is expected to increase. Alzheimer's is a progressive disease affecting memory loss and cognitive abilities, and the most common form of dementia, accounting for 60 to 80% of total cases. In 2020, Iowa reported 66,000 cases of Alzheimer's with a projection of 73,000 by 2025. Our center supports caregivers independent of whether they use our respite services or not. In Iowa, family caregivers bear the burden of the disease by providing 60 million hours of unpaid care, an estimated value of $1 billion. 63.9% of caretakers in Iowa have a chronic health condition. Informal caregivers experience high levels of stress and burden and have an increased risk of depression, anxiety, distress, social isolation, greater use of prescription medications, and increased doctor visits and hospitalizations. Studies have shown that caregivers experience reduced stress levels and better psychological well-being when adult daycare is utilized.
Services offered. As previously mentioned, the center focuses on the three pillars of care, which encompasses adult daycare for individuals with Alzheimer's, support and respite for caregivers, and connections, which offers comprehensive case management. In the first pillar, the center offers programs and courses focused on memory care, which include social events and classes, personal care assistance, daily events, and specialized therapies. Our second pillar focuses on support and respite for caregivers. This is all about providing care for the caregiver, which is made possible through support groups, educational sessions, social events and classes, in addition to Caregiver Wellness Day. Our third pillar, Connections, is a department that provides comprehensive care case management, which helps clients and their caregivers with resources in financial and healthcare planning, long-term care in-home respite, individual and family counseling, as well as self-care and mindfulness. Education and licensing requirements. According to Iowa state requirements and guidelines, Iowa certifies adult day services programs which include dementia-specific adult populations. More specifically, the requirements and guidelines clearly mandate the following: that a program manager oversees the daily operations, a registered nurse to manage and control medications, and that all employees serving in dementia-specific programs must receive a minimum of 8 hours of dementia-specific education within 30 days of employment and 2 hours of refresher training each year afterward. Also, to ensure that we surpass industry standards, we are adopting the following actions. That although there are no mandated minimum staff ratios for licensed assisted living programs in Iowa, the center would employ a 1:6 ratio based on recommendations provided by the Iowa Department of Elder Affairs, and professional liability and malpractice insurance, which will be obtained as well. Staffing requirements. The center will hire the following personnel: one program manager, licensed with an LISW in Iowa, which includes an MSW from a CSWE accredited program, and at least a minimum of 2 years of clinical experience. 3 case managers with BSWs, psychology, or related field, and a minimum of 1 year with elderly population. 2 contracted registered nurses, 1 full-time and 1 part-time, with a BA in nursing, and current and unrestricted license through the Iowa Board of Nursing, and a minimum of 2 years of clinical experience. 3 comfort keepers, which will have associate's degrees, high school diploma, or GED. And 3 social work interns, which must be currently enrolled in a CSWE accredited MSW program.
The agency will lease space on the Des Moines University campus near downtown Des Moines, Iowa. Des Moines University is a private medical and health sciences university that features an on-site, multi-specialty health clinic offering comprehensive medical, behavioral, and therapeutic care. The building is conveniently located near several retirement and assisted living facilities and includes designated parking spots for clients, drop-off areas for those arriving by private transportation, and bus links just outside. The facility itself will include private offices, 2 large multi-purpose rooms dedicated to support groups, training, and activities, as well as a large respite area that can accommodate up to 30 day care recipients each day. The facility will be ADA compliant and will accommodate 80 square feet per participant per elder affair regulations for serving individuals with cognitive impairments or those who use adaptive equipment. Agency hours will run Monday through Friday with respite services available from 8 a.m. to 5 p.m. We will offer extended hours for support groups, special events, and classes per month schedule. This may include classes for caregivers such as yoga or cooking classes. Respite will be overseen by a LISW in a safe environment and provide therapeutic activities such as games, music, art, pet therapy, physical activities, and special events. The Center for Alzheimer's Respite and Caregiver Support will also partner with many local businesses to support our operations. A partnership with DMU students and faculty aims to provide collaborative services such as educational classes, physical exercise and movement, as well as referrals for physical therapy, behavioral health, and more as indicated. The convenient location provides ease of access for appointments and therapeutic services as we are located close to the clinic. The agency will also partner with DMU to contract with the same food and environmental services vendors already on campus. Transportation needs will be contracted through a local established business who provides service for non-medical transport across the metro area. The Center for Alzheimer's Respite and Caregiver Support will be a 501c3 nonprofit organization that takes a multifaceted approach to funding the center. Initially, we would secure generous private donations and community and capacity building grants, for example, through the Des Moines Community Foundation, for renovations to begin our operations. In addition, we will secure a federal grant through the Administration for Community Living to support daily operations and payroll not covered by private donations and paid for services. The Alzheimer's Disease Program Initiative, also known as ADPI, through the Administration for Community Living, is intended to support the development and expansion of dementia-capable home and community services. The ADPI is a specific program that is meant to fund state initiatives for Alzheimer's. According to the Genworth 2021 Cost of Care Survey, the median cost of adult care in the U.S. is around $1,690 per month, or equating to about $78 per day. The center would have a fee-for-service day rate for participants utilizing the Respite daycare services. Depending on each participant's ability to pay, the center accepts insurance through Medicare, Medicaid, and most private insurance. Private or self-pay is also available. Respite services cost $90 for a full day service and $50 for a half day service. These fees may be adjusted on a sliding scale dependent on participant income to ensure equitable access to services. The center will also identify participant veteran status as part of the initial assessment to determine eligibility of the veteran's benefit. Per the Iowa Inspections and Appeal, if an adult day program determines that a participant is a veteran or a spouse, widow, or dependent of a veteran, the program may seek reimbursement through the Medical Assistance Program under Iowa Code Chapter 249A. Lastly, the center will seek subsidies for food through the Child and Adult Care Food Program. Adult care organizations must meet specific criteria, such as providing non-residential care for adults aged 60 or over. However, subsidies are paid based on meals served, and centers can be approved for up to 2 meals and 1 snack a day per adult. The center would also rely on volunteer support to provide time for special events for our caregivers, such as yoga and cooking classes, in addition to volunteer time in our Respite Care Center. We aim to diversify our funding streams to balance the peaks and troughs that wave naturally for nonprofits to ensure that we have the funding needed to support our programming.